Thank you for joining Cancer Support Community Atlanta for Understanding Your Bill, facilitated by Courtney Mason with Northside Hospital. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website and complete a new attendee form to stay connected to all future programs. Welcome everyone to today's program, Understanding Your Bill, featuring Courtney Mason. I'm Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website, cscatlanta.org, where you can see a complete list of the free oncology support services offered virtually. These range from monthly nutrition seminars to weekly stress reduction classes and education programs like these. Again, we invite you to visit our website, cscatlanta.org, where you can see a complete schedule of events. As a reminder, everyone will remain on mute for the duration of today's program. We invite you to enter questions into the program chat box, which Courtney will address at the end of the program, time permitting. I'm excited to introduce our presenter today, Courtney Mason. Courtney Mason began her career in healthcare in 2008 in Gainesville, Georgia. She has worked for Northside Hospital since 2012. During her time in healthcare, Courtney has served in many roles, including patient access representative, financial counselor, and trainer. She has earned a bachelor's degree in business administration from Capella University and is a certified health access associate and advanced certified patient accounts representative. So with that, welcome, Courtney, and I will pass it off to you to begin today's presentation.
Thank you so much, Katie. I appreciate it, and I'm excited to get started with our presentation today. And thank you, everybody, for joining us. I'm excited to see this turnout today. That's wonderful. All right. So Northside Hospital Cancer Institute Community, Understanding Your Bill. This presentation was thoughtfully designed to provide you with information and resources relating to your hospital bills and financial assistance. As Katie said, there's going to be a question and answer at the end, so if you'll enter those questions in, I'm happy to answer those at the end, and I do have a partner of mine, Tunisia, on to help answer those at the end as well. All right, today we're going to go over some insurance terminology, understanding statements and bills, what an EOB is, Cobra Assistance that we offer here at Northside Hospital, our financial assistance program, radiation oncology financial counselors, oncology business operations department, and then the research and clinical trials. So let's dive in and get started. We're going to start with the insurance terminology. The first one is deductible. This is the required payment amount determined by your health insurance contract, which is generally required to be met within a calendar year. These can be a per visit deductible, a family deductible, or an inpatient stay deductible. So I imagine a lot of you on this call, it's January, so you're just starting off on those deductibles again. A copay is a set fee you pay your provider each time you receive services for an outpatient, ER, or inpatient visit. This is the cost share portion you pay partnered with the insurance company payment for a particular service. Next is the coinsurance. It's a health insurance cost sharing requirement, which states you will assume a portion or percentage of the cost of covered services. This is typically expressed as like an 80-20, where the insurance company is paying for 80% and you're taking care of that 20%. Now, as I go through these terms, I do want to go ahead and say, if you have questions about your particular insurance plan and what your deductibles are and your copays are, I would strongly encourage you to reach out to your insurance company directly. We also have the out-of-pocket. That's the maximum amount you pay out of your pocket each year. This is one of my favorites because it's pretty self-explanatory. It's the money that comes out of your pocket. The next is a plan maximum coverage amount. This is the maximum amount of an insurance company will pay in a lifetime of covered services. And then premium, that's the monthly cost you pay to be covered by your insurance plan and receive the contractually agreed upon rate. The payment may be paid directly to your insurance company or taken out of your paycheck if you're covered by your employer. Next, we have, I'm sure you've heard, high deductible plans. To meet the criteria for a high deductible plan, these are going to be insurance plans where for an individual, the deductible, I apologize, is $1,400 or more. And for a family, it's when the deductible is $2,800 or more to qualify for that high deductible. The next is the coordination of benefits. And on a side note, this one came in personally for me. I called my mom, who is a cancer survivor, and I said, okay, what's a term you need to know or I need to share? And she said, coordination of benefits. If you have more than one insurance policy, the coordination of benefits determines which plan pays primary, secondary, and tertiary. So if you receive a bill or if you have any questions on why we're billing in what order, give us a call, give your insurance company a call, but there is a set way we have to bill those insurance plans. And then Cobra. This gives workers and their families the ability to continue insurance coverage after losing employer-sponsored healthcare coverage. And we're going to cover this, as I discussed, there's a Cobra Assistance program. We'll cover this in more detail in just a minute. All right, let's first talk about a statement versus a bill, and we're going to take a look at some examples as we go through this section. All right, Northside Hospital statement versus bill. Hospital bills are facility charges, so they're Northside Hospital charges. You will receive a statement from Northside Hospital with a breakdown of charges, insurance payments, pending insurance payments, payments you have made, and a balance due. You can expect to receive bills from providers separately from Northside Hospital, so like your radiologist, anesthesiologist, oncologist are all going to bill separately from Northside. If you have any questions regarding bills from a provider, you're going to need to contact them directly, not Northside Hospital. But if you do have questions about your Northside Hospital bills, please feel free to reach out to us. Our business office is open Monday through Friday from 8 a.m. to 4 p.m. And you can reach them at 404-851-6500. And I will go ahead and note that at the end of this presentation, all these phone numbers that I'm sharing with you, I do have a slide that's got all of them listed right there. So have a pen and paper ready, have your cell phone ready to snap a quick shot of that so you've got these resources available to you later. All right, so let's look at a statement. This is an example of a Northside Hospital statement. You can see in this section 1 here, this is going to be your account summary. It gives you the total charges, insurance payments, any insurance adjustments, patient payments, patient adjustments, your current balance, and then insurance pending payments. So we can see here in this example, the total charges were $420. The current account balance is $420, but we have a pending payment of $420. So Northside has billed the insurance company that $420 at this point. The next section, number 2, gives you the statement date, responsible party, and the corporate account number or MRN. This is another really good section to know where it is, because if you're calling and wanting more information from us about this particular bill, know where to find that MRN or medical record number, that corporate account number. That's going to be a good resource for us to look you up quickly. It's also a good way for you to identify and look at this bill or this statement and say, okay, this is for this, this statement was produced on this date. Next is the important message. This is going to be unique to each bill. For this particular bill, it's letting you know if you are on a payment plan, you're not going to receive a separate statement for that. If you have questions about that special message as it pertains to your bill, again, please give us a call. We'd love to discuss it in more detail with you. Next is the payment contact information. That's number 4 right here. That gives you our website. You can also pay by mail and pay by phone. It gives you our contact number to that business office. As I previously mentioned, that 404-845-6500. I think I've got it memorized. So if you're needing to pay the bill or needing to speak to somebody, that information is in that payment and contact information section right there on the statement. Number 5 is the information about your bill. It's letting you know that as a courtesy, we're billing your insurance plan on your behalf, but that you also may have other providers such as the radiologist, oncologist, as we previously discussed, that may also be billing on your behalf. Number 6 is the financial financial assistance information. This gives you our website and how to get to our financial assistance information through there, but also the phone number to contact us should you want to speak to us about that. And then number 7 is how to submit that payment. Now the next slide is going to go over, we flip that same sheet of paper over. We're at the top of that sheet of paper now. I will take a second to note it's not listed as 1, 2, or 3, but over here you've got the patient name, account number, facility, service, and insurance. It's a quick reference for you guys to see, okay, this is my bill, this is the account number, which again is important. If you're calling us to discuss our bill, have that account number ready. Makes it easier to pull up for us. I can see that the service happened at the Duluth campus and that it was a lab service, and we're filing HMO or Humana HMO. The next one is the date of service. it's going to give the specific date of service or the range if it was like an inpatient stay. So I know several of you are getting lots of bills that are coming or statements that are coming in all at once. Flipping that sheet of paper over, looking in that number 1 section is going to help you identify which specific statement this is for. 2 is the total charges for the visit. 3 is insurance payments and adjustments. So we can see at this point, there have not been any insurance payments on this statement. 4 is going to be your payments and adjustments. So there haven't been any patient payments on this statement at this point. The balance is $420, number 5. 6 is the insurance pending. So I know that Northside Hospital has billed the insurance for that $420. And at this point, the amount I owe is 0. Now, there is a statement below that insurance has been billed and insurance payment is pending. A detailed summary of charges for the most recent services is on the following pages, and it gives a detailed summary. Now, just below this on your statement is a summary of charges. Number 1 over here is the account information. It does have the account number here as well, but I've crossed that out, so I'm not sharing any patient information with you today. Number 2 is going to give you a summary of charges, and so we can see in this example a breakdown of the different labs that were performed that date of service. Number 3 is going to give you that total again, $420, and notice it does remind you that this is an insurance payment pending. And then to the right of that, number 4, there are 2 different statements that could appear. So if you're an insured, and I apologize because it's blocking my view of that statement, I want to make sure I say it correctly. So if you're an insured, that note is going to tell you that total charges do not represent the amount of insurance company will pay or the amount of patient liability you will owe. So at this point, we've billed your insurance company, but that amount of what they're going to pay could change, and there still could be some liability on you as the patient. And then the other note is a self-pay note. Our records indicate you are uninsured, the balance is due, and discount programs may be available. Please call to inquire. On the front of this form, you saw where you had information about our financial assistance programs, and I'll discuss those in a little bit more detail with you in just a moment. All right, now let's talk about the explanation of benefits, or EOB. An explanation of benefits, or EOB, often arrives via mail and closely resembles a medical bill. The EOB provides details about a medical insurance claim that has been processed and explains what portion was paid by the healthcare provider and what portion of the payment, if any, is the patient's responsibility. The explanation of benefits is not a bill. Any portion of the medical expense not covered by the insurance company, such as a deductible or copay, will be billed by the provider and should be paid directly to the provider. So now let's look at an example of an EOB, or an explanation of benefits. Again, we'll go through all the different sections. Number 1 is the participant's name and mailing address, or your name and mailing address. Number 2 is going to be the participant's member ID and group number. That's your insurance member ID and insurance group number. 3 covers is a summary box for all claims, including the total billed by the provider, discounts, reductions, or payments made, and the amount you owe. Number 4, right here, that's a detailed claim information for each claim that is currently outstanding for you. Number 5 is going to give you information about the provider that's billing. 6 are the claim numbers and the date the claim was processed. This is information that might be useful. Have this piece of paper in front of you should you be talking to your insurance company or provider about these specific claims. 7 is the patient name and the service date. Again, I encourage you to look in that section as you may be receiving multiple bills, and then you can identify specifically where these charges are coming from. 8 is the service description. What did you have taken care of that day? 9 is the amount billed for the service. 10 is going to be the amount covered or allowed for each service, and the reductions are subtracted from the amount for the provider billed. And then 11 is going to be important for you because that's your cost share. It's going to give you a breakdown of your deductibles, your copays, and what your cost share for the service was. 12 is the claim summary, with the amount covered less your responsibility. 13 is the healthcare fraud hotline. Should you need information about that healthcare fraud hotline, it is available right there on your EOB for you. And 14, I think, is really important. It's the deductible and or out-of-pocket expense information. So down here, what you're going to find is your deductible and how much you've met so far. So especially as we're getting into the beginning of the year and you're thinking, okay, I have a, let's say $5,000 deductible to meet, you can quickly look at this EOB and show, okay, well, I've met $3,000 of my deductible, so I've got $2,000 remaining before I've satisfied it for this calendar year. Really great reference when you're thinking about the bigger picture with your bills. All right, next let's dive into the Cobra Assistance. So Cobra gives workers and their families the ability to continue insurance coverage after losing employer-sponsored healthcare coverage. So maybe after leaving your employer, you may be eligible for Cobra coverage, which is an extension of that coverage you already had. Northside Hospital's Cobra Assistance program assists qualifying patients in paying their Cobra premium so that they may keep their insurance coverage during treatment. If you are interested in learning more about Cobra Assistance program, a Northside Hospital financial advocate can assist in determining if you qualify and help you obtain the coverage. If you would like to speak to somebody about this, there are some documents that you will need to apply for the assistance program. You're going to need a copy of the Cobra paperwork, typically receive that in the mail, and then your employer-sponsored insurance plan. So what kind of plan was it? Blue Cross Blue Shield, Aetna, United Healthcare, what was the policy number and the group number? Any questions about what documentation is going to be needed if you qualify, definitely speak to one of our financial advocates about that. We would love to have that conversation with you. And again, I'll provide those numbers at the end. Next is our financial assistance program. So Northside Hospital offers up to 100% assistance with hospital-related bills you incur during your treatment. This does not include bills you may receive from your doctor. Like we discussed earlier, it's not going to include like those radiologist reading fees, oncologists, and things like that. So some examples of services that are covered could be our facility fees, MRI, X-ray, CT. Now, again, just to reiterate, those radiologists to read those, that's going to be a separate bill and a discussion to have with that provider. Both insured and self-pay patients can apply for financial assistance. To apply, you need to complete a financial assistance application and provide the supporting documentation. The next slide has a list of supporting documentation you will need to provide with your completed application. An application can be found on the northside.com website or by speaking to one of our financial advocates at one of our 5 facilities. And I will provide that information at the end. So let's look now at what you would need to apply for the financial assistance program. We're going to need a copy of a proof of income. That could include a recent pay statement, your current W-2s, a notarized letter of support, a mortgage statement or lease agreement, medically necessary bills, federally approved student loans, house bills, which could be your utility, gas, cable, and then other expenses you incur, your health insurance, life insurance, childcare. Depending on your situation, if you want to apply for financial assistance or speak to somebody about it, talk to one of our financial advocates. They'll be able to dive in more detail with you about what documentation you would need to provide in your situation to apply for financial assistance. All right, radiation, oncology, financial advocate. Too much coffee. Okay, if you are receiving treatment at Northside Hospital Cancer Institute Radiation Oncology in Atlanta, they can discuss financial assistance options with you based on your treatment plan. If you would like to learn more, ask to speak to somebody about financial assistance options during your next visit or call them directly at 404-575-2063 and ask to speak to the financial counselor. This is not something I can speak to directly, but I've spoken to that financial counselor and they would love to have that conversation with you if that's something that's an option. Now the Oncology Business Operations Department. The Oncology Business Operations Department or office, like the Radiation Oncology Financial Counselor, can discuss financial assistance options with you based on your treatment plan. Most of what they can offer relates to drug copay assistance for oncology drugs. If you would like more information, you can contact the Oncology Business Department at 404-300-2057. I think we did have a question about drug coverage and copay. Not something I can speak directly to, but this is definitely a resource for you to reach out to. And then the research and clinical trials. Research and clinical trials are done to research the effectiveness of new treatments or medications. Financial assistance is sometimes offered to patients for participation in a trial. Considering participating in a research and clinical trial is a personal decision that you should make with your doctor. If you would like more information, please speak to your doctor, your oncologist, directly about those opportunities and options out there for you if they're available. All right, and that was our presentation today. I thank you so much for taking the time to listen to me and to go with me as we reviewed some of your financial assistance options, EOB, statements. Before I invite Katie back in, I am going to go ahead and toggle to my next page. As promised, here is a list of all those phone numbers, the financial advocate for all 5 of our facilities, along with our business office, that oncology financial counselor number, and the business operations number. So if you've got your pens and pencils handy, got a cell phone for your records going forward. And then Katie, I'm going to invite you back in to help us get started with the Q&A.
Thank you, Courtney. A lot of good information. And thank you, everyone. We got a really good amount of questions coming in the chat box. So again, we welcome you to enter any questions you may have into that chat box today. So I'm going to jump to this first question. Should your insurance be routinely mailing you an explanation of benefits? And I guess how often should they be sending that to you?
I am going to defer to the insurance company because I'm not sure based on your insurance company how routinely they send them. I would say give them a call directly and say, okay, what can I expect if you're not receiving them routinely or you feel like you're receiving too many? That's going to be based on your insurance and they'd be able to better answer that for you.
Okay. And then I think this kind of goes to what you were talking about Cobra. Is there a maximum amount of time that can lapse between you having insurance through your work and then applying for Cobra?
I don't know the specific amount of time. I know there's a relatively small window. If you think that you're within that window or even close, please call our financial advocates and they can work with you on determining if you are within that window that we can help assist you with your Cobra benefits.
Okay, sounds good. And I know you were saying this was a really important piece in the beginning of the presentation regarding coordination of benefits. Is there a general process or I guess a way to better understand which insurance company would cover which cost, primary versus secondary without all the representatives?
That is a really great question, and that's part of why I deferred to my mom because that's a complicated one. And I wish I had an easy, straightforward answer, but there are a lot of rules that sit in the background depending on who's the primary of the insurance, who's paying for the policy. Is it a government insurance like a Medicare, Medicaid, TRICARE, or is it a commercial insurance like a Blue Cross or United Healthcare? So without knowing your specific plan details and what you're covered by, I can't answer too much more specifically. But reaching out to a member of our business department to talk about your bill and how we build it, reaching out to your insurance company, they can speak more specifically to it. And I'm sorry, I can't give a more specific answer. There's a lot of rules that sit back there to determine that coordination of benefits.
Okay, sounds like probably a lot of moving pieces and details. So reaching out to
yes
can help you with this.
But it is good to know and be aware that there is a certain order that we have to bill your insurance, and we can't choose who we bill or the order in which we bill it. There is a set order for that exists.
Okay, great. I think we also have a couple questions about financial assistance. One is, how do you know if you really are eligible financial assistance, even if you have insurance? Is there, I think you said there, you could still be eligible.
Absolutely. And I can't definitely reach out to one of our financial advocates because you can be eligible for up to 100%. So maybe you're in a situation where you're insured, you're still employed, but we can offer you a percentage other than 100%. So I can't speak specifically to your situation, but we do have several different levels and layers. So call us, talk to us directly, let us know what your situation is. We want to work with you. And there may be some opportunities still out there, even if you are insured and are still employed, to receive some help with your medical costs.
Okay. And I think you said folks could visit the Northside website to get more information
Absolutely.
about financial assistance?
Absolutely, yes.
Okay, and another one along that lines, if a patient has a high deductible insurance plan, does that make them eligible financial assistance to help cover that deductible? I don't know if that'll be the same answer.
It's going to be the same answer. Just it all depends on your specific situation. Just having a high deductible plan doesn't necessarily qualify you or disqualify you. But definitely, I can understand with high deductible plans, you're incurring quite a bit of a cost. So speak to one of our financial advocates about your specific situation. We're here to help. We want to have this conversation with you and see what we can do.
Great. And someone else asking, does financial assistance, when they're taking that into consideration, if you're eligible, do they include student loans for dependents or expenses for a whole household, or is it just submitting patient expenses?
The expenses are going to be for the household. You're submitting your household, your mortgage or your lease and your household utility bills and things like that. I don't want to say more specifically because I don't know your situation. Is this an independent older child with student loans or what the case may be? Again, I'm going to defer back to our financial counselors who can have that very specific, good conversation with you about your situation and see what we can do to help.
Okay, great. And this is another financial assistance question. Does financial assistance absolutely need to be approved prior to a date of service, or can it be applied retroactively?
That is a good question. Denise, can you offer any insight on that?
Actually, yes. So financial assistance can be applied retroactively. So if you present for a date of service, of course, you will have to have a financial conversation with one of our financial advocates. At that point, they can walk you through the process because it is, again, based on sliding scale. So there's a period of time where we would need to receive those benefits and that documentation from you. And then our financial counselors will work to work on qualifying you. And then it also gives you a set approval time. So typically financial coverage, financial assistance is covered for 6 months at a time. So you would apply twice per year if you foresee, the need for ongoing financial assistance. So you would just do that application twice a year to keep that going. And of course, everyone's situation changes, financial income changes, bills, all of those things change. So if there is ever a change, please notify us, and then our financial counselors can work with you to readjust, your sliding scale assistance.
And I would encourage, if you know that you've got upcoming appointments and visits, go ahead and reach out to us now so we can get the ball rolling, get things moving, because we do understand that the amount of documentation we're asking for is quite a bit. We want to make sure we've given you that time to get it all together. So, you don't have to wait till day of to reach out to us. Give us a call now if you've got some upcoming visits.
Okay, thank you both. There are a couple questions regarding bills. So I will ask you guys those. One person mentioned, I recently received my treatment plan from my oncologist. Who should I speak with about the financial cost of treatment or prescriptions and how much I can anticipate insurance covering?
Yes, so as far as the Northside Hospital, you can speak to one of our financial advocates about what the facility and our provider costs are going to be. Specifics about the prescription coverage, we can give you a general idea of what the cost, not prescription coverage. For prescription coverage, that's not something that we can speak to. That would be a conversation with your physician, and of course, any of your physician bills would be a conversation with your physician. But if you're looking at the Northside Hospital's cost, we can definitely break down and give you an idea of what that will cost if you speak to one of our advocates.
Okay. And do people generally get that information? They can get it from their oncology group or from Northside Hospital?
Hi, Courtney.
Yes.
I was just going to say it's really going to be a joint 360 effort because again, Northside can certainly assist you with your hospital fees, and then of course your prescription coverage and what is going to be coverage depends on the type of insurance you have and what pharmacies that those particular insurance companies choose to relate to or contract with or do business with. So if you have Blue Cross may require that you fill all of your prescriptions through CVS and, things of that nature. So all of that is price dependent. But again, it's just each individual piece that makes up the whole. So we can certainly assist with our Northside part. Please contact your insurance company regarding your prescription costs. Talk to your preferred pharmacy to see if it's something that they can accommodate for you, and also speak with your physician regarding treatment plans, because sometimes physicians unknowingly prescribe brand names where the prescription coverage may only cover the generic, which is, maybe just as good. So there's a lot of moving parts there that can help you get the care you need.
Yeah, it sounds like a lot of coordination of care. So kind of figuring out all those pieces and following up with them.
Absolutely.
Mm-hmm. And the next question someone asked, can I access a detailed bill online through Northside?
Yes, you can. We do offer the My One Chart service, so you can certainly sign up for access through My One Chart. Once you establish that secure connection, then yes, you can pull up all of your detailed statements. You can pay your statements. You can request. You can view your medical records. So there's a lot of things that My One Chart offers, and that's also, I believe we do have a link for that as well. We can certainly include one to be able to share that information.
Mm-hmm. Okay, great. And
that option is, sorry.
Go ahead, you're fine.
I was just going to say, signing up for My One Chart is offered at the time of service. So when you come in for registration, we're going to offer that to you right then and there at time of service and get you signed up and started with that, if that's something you're interested in.
Okay, great. And then a participant shared that they've been receiving treatment for about 12 years. And of course, that comes with probably a lot of paperwork and printed bills. How long should they keep that paperwork on record? And is there a good way to sort of organize it?
Yes. So as far as how long you should keep it, I don't want to speak specifically to that because, I think it's always good to keep a record. But as far as the status of your bills and where they are and when you can kind of archive them or, you need to be paying attention, call and speak to somebody from our business office, find out the status of things, make sure that you've got everything in order and tucked away. Denise and I actually talked about this right before it started. There's a lot of electronic systems now where you can save and archive those so you don't have all those papers. But as far as how long to keep them, that's going to be unique to you. And I would encourage you to reach out to somebody and make sure before you start to get rid of anything that it's tucked away and taken care of. And Denise, since we spoke to that earlier, did you have anything to add?
No, that was just my suggestion. I'll, keep an active file. And, typically when I have a lot of moving parts, if I've had a conversation with that particular business office and they have assured me that this claim is paid in full, then I can rest assured that I can kind of move that to either an electronic file that says paid in full or satisfied, or, a manual filing system that says the same. But I would encourage you to maintain documents with that kind of information for as long as you deem necessary.
Yeah, I like the suggestion of keeping things electronic. It's harder for them to get lost, for sure.
Yeah, for sure. Absolutely.
Another question regarding a bill, participant shares, I often get mail from Northside saying this is not a bill. Mm-hmm. What's the time frame that I could expect it to be sent to the insurance and to get a final bill?
Absolutely. So this is not a bill, like we discussed earlier, that statement in EOB, within 5 days after service, we're going to send that statement out to you with that breakdown that we went over earlier. And then let me make sure I've got this right. Usually within 21 to 35 days after you receive that, that's when you're going to start to see that final bill. And that gives that window of adjudication with the insurance company for them to make payments and for us to coordinate with them to determine what your patient liability is going to be.
Okay. And then another bill-related question. Someone once told me it was possible to negotiate a bill amount with my provider's billing department. Is this true? And if so, what would be helpful to know prior to initiating this conversation?
Absolutely. Give us a call. We want to help you and support you and be there for you. All you have to do is call our financial advocates. I don't know, I would say negotiating so much as talking to us about the programs and opportunities that are out there for us to help assist you with some of our the Cobra Assistance, or just our I'm losing the words, I apologize, financial assistance program. We've got lots of resources and tools out there for you. Give us a call. There's not a right or wrong way to start that conversation. We're here to help, and we want to see what we can do for you.
And Courtney, I just want to add that, Northside, as an organization, we do offer total price transparency. So, I wouldn't say negotiate would be the right word, because the price of a service is the price of a service, but we can certainly work with you to, again, come to terms with responsibility, maybe through a combination of insurance and the financial assistance programs that we offer.
That's a good point. Thank you, Denicia.
Okay, great. Thank you, guys. I think I'm going to sort of transition into some questions about insurance. A participant asked, could you go over the process of once you meet your out-of-pocket threshold and deductible, are you still paying a copay and or co-insurance?
Denicia, I'm sorry, my computer just turned off. Would you mind answering that one?
Okay, I'm sorry. Could you repeat? So was the question once you've satisfied deductible and out of pocket?
The question was, let's see, once you meet your out of pocket threshold and deductible, are you still paying a copay and or co-insurance?
So once you've met your deductible and your out of pocket, typically, no, that is when the insurance company says, hey, you've satisfied your portion. So there may be some particular services that will still require a copay, but beyond that, you should be covered according to the terms of your insurance plan.
Okay, great. Thank you.
And Katie, I'm sorry, I think I lost my screen share. Did you want me to put that back up?
That's okay. I think if folks can let me know in the chat box if they would like those numbers back up, and we can put it back up. And
sorry about that, everyone.
That's okay. I think this is another question sort of about insurance. A participant shared that they went in network for a scan, but then got an out of network bill for their radiologist. Is there any way to know up front, I guess, if you're going in network for something, if the radiologist will also be in network?
That's a great question, and we do run into that on occasion. I would say before your visit, be proactive and call and ensure that the radiologist that's going to be reading, I can't speak directly to what your insurance company is in network and out of network for, and that does occasionally happen. So call ahead of time, reach out and find out, okay, who's the radiologist that's reading this service? Reach out to your insurance company and find out, is this an in-network or out-of-network? So before you end up in that situation, unfortunately, you can know ahead of time and maybe make some different decisions about where or who's going to be reading those orders.
Okay, thank you. And this is another insurance-related question. Are there any steps to take when your insurance company won't cover procedures your physician suggests?
Yes. So the first step would be to go back to your physician and have that conversation with them and find out if maybe there's a different procedure or something that the insurance company may cover, or there's other options there. But also there's options here with us at Northside. You can elect to be a self-pay patient and not file your insurance. And we do have some self-pay discount programs where if you're able to pay upfront, we've got prompt pay discounts of 70 and 65% with payment plan options with one of those. That's a conversation to have with your physician, and then a conversation to have with one of our financial advocates to see if self-pay might be an option you can consider with the doctor field.
Okay, thank you. The next question is, again, sort of regarding insurance and the appeal process. Often the estimate given for services is different than the actual bill I've received. Is there an appeal process to take?
any discrepancy about your bill, definitely reach out to us. Unfortunately, when we're giving you an estimate, it is just that, it's an estimate, and we do the very best we can to give you the most accurate estimate at the time of service, but we don't know once you get back there in the procedure if there's going to be additional procedures that take place or any additional charges based on what the doctor requires from that. So the best we have is the estimate to give you at time of service. If you feel something is inaccurate, reach out to our business office and we can take a more detailed look at your specific situation and see what's going on.
Okay, thank you. I think we're wrapping up on the questions. If anybody has any kind of final questions they want to enter into the chat box. And I think this was one you might have touched on earlier. How soon after receiving services should I expect to receive a statement from Northside Hospital?
The statement goes out 5 days after services. And again, that's the statement like we went over earlier where I showed you that the insurance was pending, that we had billed your insurance and there wasn't any patient liability at that point. And then give us 21 to 35 days for that adjudication with the insurance company to work out getting payment. And that's when you should start to see that final bill and what your liability is going to be.
Okay, thank you. And we have a few people have entered into the chat box how grateful they are for the financial assistance they received while going through treatment. So thank you guys for sharing that. And as we wrap up, Courtney, do you have any kind of final thoughts that you'd like to share with us?
I just want to say thank you to everybody who joined us here today. This was a very honor for me to have been asked to give this presentation. I hope it was beneficial. I hope it helped. I hope you got those numbers down because we are here to help. We want to have these conversations with you and do what we can. So thank you. And thank you to Katie for helping facilitate and Denicia for being on here with me to help answer some of these questions for you today.
Yeah, absolutely. And Denicia, I'll also invite you if you have any kind of final thoughts to share.
No, I just want to say thank you again. I appreciate the opportunity. And, it kind of hits, near and dear to home because both Courtney and our mothers, we were, they both went through, recent cancer, treatment. So it's kind of, we want patients to be assured that as they're going through their care, that they do have the resources available then for them to maintain their wellness. We don't want that added stress factor to be involved in their treatment of care. So anything that we can do here at Northside to facilitate that and let you know it's available, we're more than happy to do so.
Well, thank you both. All of your assistance is much appreciated. Thank you so much for being so gracious with your time and expertise. We're getting a lot of thanks in the chat box, people finding the Q&A very helpful. So thank you again both for your time today. If anybody knows of someone who wasn't able to join us for today's presentation, you can find a copy of it on our website, and that's cscatlanta.org. And you can also find additional resources there on the virtual oncology support services available. So thank you guys both again, and everybody have a great weekend.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org. Or follow us on Facebook. We'll be sharing additional information on upcoming programs.